We hear a lot about the number of people that have passed away because of COVID, and of course, the impact it has had on our health and all the various ramifications of this disease on our hospitals and, of course, emergency workers. But there's another aspect I wanted to delve into now, and that is those impacted by the lockdown. We know that suicide rates are up. We know that domestic violence is up. We know that problems from untreated health issues on the increase. So we know that folks are struggling due to this pandemic, and not only folks out there in the general community, but healthcare workers are as well. So I wanted to bring on someone with an expert opinion on it. Susan Harrington is with us. She's a licensed professional counselor, licensed marriage and family therapist, and she is with us here on the Ringside Hotline. And Susan, good morning. Welcome.
Good morning, Jeff. Thanks for having me.
Well, thanks so much for being with us. And my daughter is studying to be a mental health counselor, and I'm a psychology major myself from back in the day. So I certainly appreciate the good work that you and others are doing to help folks. And I certainly am worried about people dealing with this pandemic. Just the average citizen been forced out of a job, been forced to stay at home, been forced to get out of their routines, not allowed to go to church, not allowed to do what they normally do. And a lot of people are really, really suffering with a mental health issue during this crisis. Wouldn't you agree?
I would agree. Our healthcare workers are probably having one of the highest levels of stress, but they're not alone in that experience.
I think everybody, just the average American who maybe someone who works at a restaurant has been laid off, or a bar, or someone who hadn't been able to do an event, and people that rely on special events or tourism or hotels, or all these industries have been devastated, and that's stressful.
Absolutely, absolutely. I talk with people every day that are trying to figure out how to do life right now and still manage what's going on for them from the pandemic perspective, their regular life distress, as well as just living on a daily basis sometimes.
So you offer help for people that are on the front lines, healthcare workers and their families, certainly folks that are dealing with COVID patients and an increase are stressed out. So how do you help the helpers?
So one of the things we're doing here at Maison Vie to help the helpers is we want to really be affirming of the work that they're doing by extending to their families as well. So we're offering a free 90-minute session for the families of healthcare workers. So that means that the healthcare worker, the first responder, these essential workers can participate. However, what we're knowing more specifically about the healthcare worker and their families is those workers are doing 12, 14-hour shifts and coming home exhausted, and the families feel the absence of that member in the household. And so that's why we're reaching out to the family members and offering them an opportunity to come in and figure out just how to take care of themselves and then care for the worker that's coming home stressed.
So this is targeted just to healthcare workers and their families, right, Susan?
Healthcare workers, first responders, and essential workers. Everybody who had that, in the beginning of the
someone
phase one
maybe an
status.
EMT, someone working fire, police, someone maybe working at a grocery store, a drugstore that has had to be working maybe long hours. All of them are also included?
Exactly. Yes, sir. Anybody who has a family member that's in that status, they are welcome to call, and they get that free 90-minute appointment.
Let's look at some numbers. 1 in 3 are suffering from insomnia. I know some people that are dealing with it also. And 1 in 4 experience depression and anxiety. And I would assume the depression and anxiety is connected with the insomnia, right?
Absolutely. And so is depression. They're both connected. Depression, anxiety, suicide rates, all those things, domestic violence, that's all up. And that has a direct connection to insomnia. And insomnia is one of the symptoms that we really see happening. what we're noticing is that healthcare workers are at high risk right now. Healthcare workers, more specifically, are at high risk to acquiring post-traumatic stress disorder because of the work environment that they have, that they're having to live in and make these hard decisions about which patients to prioritize, because everyone who has that diagnosis is high on the priority list. And we still have our regular crisis and urgent patients at the hospital as well.
Yeah, and you have the, of course, physical risk of maybe being exposed to the disease, and we know that that has happened. Then, of course, you've got the mental health risks of the depression and the anxiety and insomnia and other issues that the folks are dealing with, and their family members, because it doesn't just stay with that one individual; it also expands to the family. Yes. So this is something that even the World Health Organization has identified, right, Susan, as a problem?
It has. I mean, we have so much information now that's becoming more and more available because there's active research happening around the impact from this pandemic across each country and how it's different and being handled different because of its governmental status, as well as what's happening to our family members. You know, I worry about the children in these families, the young children who are preschool, and they're used to their parent being there every day, and they don't have it, and what's happening for them. Those little ones become depressed.
Imagine the situation that puts these folks in that would like to maybe be home with the kids but can't be, and then
choose not to be,
or in a situation where the kids are normally in school, but now because of COVID are not, so having to do this remote learning. So how can a parent then actually do their job if they've got a kid at home doing remote learning? Aren't they going to have to be there with the kids? So either the education is going to suffer, the family life is going to suffer, your mental health is going to suffer from all of these changes.
Absolutely. You know, what we're noticing is the reaction is that if the healthcare worker or the first responder is in a significant adult relationship, then the relationship is going to begin to struggle. There might be family violence because of the irritability and the distress. There might be neglect of the family. That'll happen from either parent in that situation. The children will begin to have behavioral issues. That'll begin to show up. And being at school, in school, or being home, and then managing where the child's supposed to be when, as the hybrid system kicks into gear now, and that setup, it makes more confusion and disrupts the cycle and the routine. And we learned way back for Katrina how important routine was for us and is for us. And so doing this hybrid means the routine is not the same every day, and that also causes problems. I know with a lot of families that I've talked with, they're working at being very creative and trying to resolve the solutions. It's going back to the philosophy of it takes a neighborhood to raise a child, because if for a single parent who's a healthcare worker or an essential worker or a first responder, they have to rely on the other parent who they may not be interacting with well. They have to rely with the grandparents and aunts and uncles and daycare workers who are another part of our essential team. All of this, right? So we're having to really do the neighborhood piece. One family I met with, they coordinated the block. So they had 3 or 4 families on that block that the kids played together. And so now what they've done is 2 parents are responsible for the children on this day, and 2 parents are responsible on this day. Like they've assigned days that the children sit at their
that's
houses.
interesting, because I've also heard that people are doing that with education, that they've been learning pods where, you have maybe certain parents that are providing education for their kid extended to others. So it's like a small group. And that way, the parents are helping out other parents who might need, to go to work and might need someone to watch over their kids. So
and it also does a piece. It also
got to have some real creative solutions here to all this.
Right, it does, the creative solutions, because what you're talking about sets up an opportunity for a COVID practice, right? So we are interacting with one another. And monitoring each other's safety and health. And so that sets up these little pods of safety to do that. It's just an extended family is what it is.
Now, tell our listeners, if you can, in our final few minutes here about Maison Vie.
So Maison Vie is a family therapy agency. We specialize in working with relationships, whether that's a couple or a family unit or a parent and a child. We've worked with adult siblings. A relational unit that's significant to you. It's what we specialize in. And we are on the West Bank. We are providing services both virtual as well as in the office.
Great.
So we have,
now, if any of our listeners want to take advantage of these free sessions that you're offering here, which are so helpful and so needed, how can they sign up?
So they can just call me directly. Maison Vie has a website. It's maisonvie.neworleans.com. And they can call me directly at 504-452-5937. And you can do a contact form on the website, or you can call me directly and have a conversation, and we'll set it up for you.
And the sessions are available either in person or online, right, Susan?
Correct. 7 days a week. Oh, I'm sorry, 6 days a week. Not
6
Sundays,
days
but
a
the
week.
other days.
And you're going to be doing this all the way through the end of 2020?
We are. Through December 31st, we're going to offer that availability. We are.
Yeah. And what is key here is it's not just 5 minutes on the phone. This is a 90-minute session, so
it is.
This is
and
amazing.
It's not just 90 minutes, right? So what's going to happen is they're going to meet with one of the therapists we have on staff. And in between the appointment, at some point, she will consult with me as the supervisor, and we will get together and figure out what's going to be in best interest and offer the family back some options for resources and plans and things to address simply how to attend to bringing recovery in the house, how to take care of their needs while the healthcare worker and the first responder, the essential folks, right? So that when they come back into the home, it's a welcoming environment, and that will help limit the possibility of PTSD setting in.
And if additional sessions are requested or needed, appointments will be available at reduced rates.
Sure,
which,
absolutely,
again,
as well as help them use their
generous.
own resources. They may have insurance as their own. We could help them find someone specifically that would be affordable for them if ours are not affordable.
Susan Harrington, thank you so much for your time this morning, and thank you for this service that you're providing. And we're going to link to it where people can get more information. Just check out our podcast page, MaisonVieNewOrleans.com. Check it out. Thank you, Susan Harrington. We'll have a brief time out. When we come back, we'll open up our phone lines again. Any topic you want to address, fair game, 504-556-9696. Our talk.